In the previous session, we have discussed about the action of the anticholinergic agents on the eye. The anticholinergic agents produces mydriasis as well as the cycloplasia. And these mydriasis and cycloplasia, both these required for testing the refractory error. Now, in connection with that point, that which agents we should prefer for testing the refractory error. Now that depends on the onset and the duration of the agent. Now the naturally occurring agent, that is atropine. Now atropine causes cycloplasia. The onset of action is now for easy to remember. As far as the onset of action is concerned, majority of the agents, they are having similar onset of action, roughly ranges from 30 to 60 minutes. The difference is only the duration of the action. So atropine onset of the mydriasis and cycloplasia ranges from 30 to 60 minutes. It varies from person to person, but the person is visually handicapped for a week. That is not acceptable. And that's why even though the atropine is a very powerful mydriatic as well as cycloplegic, but it is not preferred for the adult for testing the refractory error. Now, which are the other options that we are having? So after the atropine, the next is home atropine. Now the home atropine, it is 10 times less potent as compared to the atropine. As I have already told, the duration of action is nearly same, 30 to 45 minutes. But again, its action, even though it is having a shorter duration of action, but still its action lasts for 1 to 2 or 1 to 3 days. Okay, but it is more than 1 day. So this is also not acceptable. Okay, and additionally, the home atropine is 10 times less potent. Okay, now which other agents that we are having? That is cyclopentolate. Cyclopentolate. Okay. The duration of the the onset of the cyclopentolate is again nearly the same, 30 to 45 minutes, and its action lasts for about a day, 1 day. Okay, and it has been observed that cyclopentolate is having some CNS action also. It produces the behavioral abnormalities also, and that's why it is not preferred in the children. Okay, that's now home atropine. As I told you, it is 10 times less potent, and in the children, we require a more potent agent because the tone of the ciliary muscle is very high. So in the children, the home atropine is also not preferred. Okay. Now, which is the another agent? That is tropicamide. Now, why I have kept this as a capital? The reason is that it is the quickest and the briefest duration of action. Its action starts within 20 to 30 minutes and its action remains for 6 to 8 hours. Okay, there is an inter-individual variation. Okay, so if someone asks you which is the quickest and the briefest action, the answer is tropicamide. And that's why the tropicamide is preferred in the adult for checking the refractory error. So when someone asks you which agent is preferred in the adult, then the answer is tropicamide. Okay. Now the next question is, can we use tropicamide for the children? The answer is no. What is the reason? The reason is that its potency, efficacy is less. We require an agent which is having a more potent cycloplegic action, and that's why atropine, 1% atropine is preferred in the children. Okay, so this is about the selection of agent. Thank you.